Thank you. All right.
Clicking some slides here. Where's the mouse at? Is it there?
Yeah.
Oh,
Oh, there we go. Hi, everybody. We are going to go ahead and get started. I'm so thrilled to see a room full of folks today. Hi, everyone. Okay, there we go. Let me get started. I want to thank you all for joining us. We are really excited to be back in person with our Community Engagement Forum for the first time since before the pandemic. So we kicked off the Community Engagement Forum the first time, I think, end of 2019 or very early 2020, and have had to move this all virtual, which is not the same as this wonderful experience of having all of these partners in the room together. So thank you all for making the time to be here from across town or across campus. This is just wonderful. So I am Sarah Brewer. I'm the director of our education program at Accords. And this is our community engagement forum, which we do in partnership with the CCTSI Community Engagement and Health Equity Core. A few things before we get started, and I do a little more intro. First, if you are just wandering in, we have lunch for you right outside the doors here. You can see in the back windows. Please take a minute, step outside, grab yourself some lunch. Now during our brief formal program is a good time to eat, so don't be shy about grabbing lunch. If you are not familiar with the building, restrooms are around the stairs over here and down the hall. They're on your left, past the large conference room. So in case anybody needs them, restrooms are over there. And today, I just want to talk a little bit about how we got here this year. So our community engagement forum is really focused on helping both community partners and academics figure out how to work together, the methods for doing that, the principles that we follow, some of the just logistics of building partnership across academic and community boundaries. And this year, we have really focused on how the community-based participatory research principles can help guide us in doing that and how we can embody those in our work. So I want to sort of point us to where we've been this year. So we started this year's series last July with a really engaged session. We talked about those principles, and then we heard from all of you and probably many others who are not here today about what were some of the struggles and successes that you've had in community academic partnerships, especially around research, how those fit with some of the CBPR principles. And that's really set the stage for the rest of this year. We then moved on to talking about what is representation? What are some of the ways that communities show up in the projects and collaborations that we do together? What does that mean and look like in our partnerships? So that was our second in this year's series. And then in January, we really focused on capacity building. How do we think about building the infrastructure, the skills, the knowledge that community partners and academics need to be able to do these partnerships really well together? And today, as sort of a wrap up for this year's series, we really want to focus on one, bringing people together just in the same space, but also for you all to make new connections, hopefully meet a new partner or somebody you can envision partnering with. And thinking about how we can do this in a way that focuses on sustainability and building health equity in communities. So really thinking about some of those longer term principles of community-based participatory research. How can we do this in a way that really changes the communities that we all live and work in? Okay, I am going to hand over our program for the next little bit to Don Neese, who is the director of the Community Engagement and Health Equity Core. And we are going to hear from some of our leaders here on campus about the work that is happening and some of the resources for fostering these kind of partnerships. So, Don, it's all yours.
Great. So
Maybe.
I have one. They made two for us, you know, they know how to take care of us. Okay, let's see here. All right. So when we were dreaming up what we were going to do today, and I'm a wanderer, so I'll try and make sure the mic picks me up. But we thought it was really important not just to gather participants from this campus that are interested in doing this kind of work and wonderful community partners. Talk louder. Okay. Hello. Yeah, right. Wow. But we also wanted to bring in campus leaders that lead infrastructures that have community engagement as a really core part of their mission. In the now, I guess, almost 12 years since I've been in my role as Director of Community Engagement and Health Equity for our Clinical and Translational Sciences Institute, I have been so pleased to see how community engagement has continued to become more and more of a priority across our campus. We have some history to overcome. We acknowledge that, and we are working hard, but we thought that it would be great to have some of our campus leaders that are also on our campus team carrying this banner come and speak with you all. So we have Dr. Regina Richards who's our Vice Chancellor for Diversity, Equity, Inclusion, and Community Engagement, or as we like to call it, the ODICE. Dr. Jerica Berg from our Accord Center, Dr. Deborah Parra-Medina, our newest leader in this space, who joined us to direct our Center for Health Equity. And then finally, I'll say a few words about our CCTSI core. So, Dr. Richards, please.
A wanderer too, but they're clapping for you, Don, not me. I just wanted to be clear, so we don't blur the lines. Good afternoon. I know it's really just like late morning, but oh, I see all my friends in here. This is so great. How are you? So good afternoon. Here's the thing. If you don't talk back to me, I'm not gonna really be talking to you. I need to know that y'all are in it to get it, and that we're in it together. So for the third time, I'm gonna say, good afternoon. Community engagement is about bringing people together and engaging with the community. I'm not gonna just sit up here and talk to you. I want you all to be engaged with me as well. Got it? Got it. There probably won't be any of them to be. I want to set the tone nonetheless. Thank you. I'm really honored to be here today and to really call myself a partner in the collaboration with what is happening with CCTSI. Quick story. When I first came to this campus, so I'm a product of this institution, meaning that I've grown up in this institution, so I've been around decades. But when I first took my position as Director of Diversity for the medical school, in the first week, I was engaged with the leadership with CCTSI and had an immersion experience. That's right, woo, Leslie, an immersion experience. And we went to Pittsburgh together. And I was 1 week into the job, excited about it, but a little overwhelmed by it all because the School of Medicine is so big. And, you know, a few of us went down to the University of Pittsburgh, and we learned a lot in a short period of time. And I know that it has impacted the work that we do. And I'm so excited to have my buddy Leslie Wright continue on this journey with me to do this in community engagement work. One of the primary things, I got plenty of stories, but I'm going to get to the slides in a second. One of the primary things that I negotiated in taking this position as the Vice Chancellor for Diversity, Equity, Inclusion was to add community engagement. Oftentimes, we know in historical universities and the hierarchy of medicine, that community is always an add-on. But I wanted to make sure that we were bold in our statement to say that it is and community engagement. There was pushback, and that's okay, because those that know me well know I love to color outside the lines, and said that this is really part of the contingency of me taking this position, that it had to be an add-on, because we need to elevate our communities, not just internally, but the external communities around us. And so I'm so honored to really be here and to be engaged in this work with you all. I'm advancing the slides by using them. I got a lot of skills. Technology ain't one of them. That's not me. There we go. No, it's okay if, you know, mine came maybe 20 minutes before this presentation, so it's okay. Yes. Okay, so, I convened this office, July 2020 in the middle of the pandemic. I'm so grateful for the chancellor for his vision to say, we need an office that really is going to focus on equity, inclusion, and community engagement in a different way, but also be able to do some partnerships. And so, literally the first, month that I had this position, I went to the chancellor to say, can you please contact the deans of the schools and colleges here on campus? Because I'd like to develop a chancellor's ODICE leadership council for the purposes of, number one, holding me accountable for this work and also being a partner in this work with me. I needed the deans to appoint someone with FTE, so not an add-on to their job, as in, let's volunteer. How many volunteers can we get to do community engagement and inclusive and equity work? But someone who has FTE to really be able to sit on this council where, again, we can work collectively together. And so within 3 weeks, I had a liaison from every school and college on this campus. And then we started just growing expeditiously. And we have a council of about 30 people, and we meet monthly and have since September of 2000. So I'm excited. That group has also helped me, helped us really develop our mission statement. As you all know, I'm sure you've been involved in many activities to create a mission statement. We wanted to be sure that it brought forward the voices of the community, not just the internal, but the external community, and for us to use language specific to what it is we were trying to do. And so we came up with this, and it is really we are committed to transforming and advancing policies, programs, and practices that address social injustices and health disparities alongside the communities we serve. Now, you all are here because you are engaged with the community, so I don't have to tell you the power in saying alongside the communities. It is not for, it is not by, it is alongside. Because if we don't have that external community keeping us accountable for what we do on this campus, then what are we really doing towards moving the needle from disparities to health equity? So I'm very proud of that. And consequently, this is who we are. It's a big org chart. But basically it gives you an idea of the core areas of our office. I report directly to the chancellor. Here is the Chancellor's Diversity Leadership Council, which again, has representatives from the schools and colleges, but also from other entities on this campus and external to the campus as well. We really focus on access, and that is access literally from pipeline programs to practice. And here is just an overview of what this team looks like. I'm so grateful for the resources from the chancellor to be able to have a team this size and to really have the reach that we are having. In the next couple of months, we will release our first impact report. Last year, we released a report called Innovation for Change. And our model really comes from the social science, utilizing the framework of the socio-ecological model for organizational change management. And so now it's about what can we do to report the impact of all of these various different cores that we have. Center for Health Equity is not here on this org chart. Welcome, Deborah. We're super excited, but we will have a line to that project as well. We're super excited about that. So here are the primary, the DEI focused areas that we really are basing the work on. It's important for us to increase campus-wide belonging. What does that really mean? It is that we know this is a predominantly white institution, but we want to make sure that everyone that comes here feels as though they belong here. They have a right to be here, that it does not matter about your background, the social intersections of your identity. You need to know when you come to this campus that you belong here. We're plopped right dead smack into this community, and people need to know that they are welcome here and that we value who they are and what they bring. I'm super excited, and please know that this is not an exhaustive list of our partnerships, but it has been my intention and my team's intention to really be proactive in reaching out to say, we cannot do this work alone. And here are the primary groups that we've already engaged with. Again, not an exhaustive list, but as we're working and moving this campus forward related to our campus-wide mission-focused areas and strategic initiatives, here are the partnerships that we currently have and we keep building. What I know for sure is the last inventory we took, there's 72 organizations that are partnering with us on a regular basis. That takes relationship building, that takes trust, that takes not promising what we can't do, but actually doing what we say we're going to do, and follow-up and consistency. I don't have to tell you, I know I'm preaching to the choir, but that is the core of who we are and what we are doing in this work. We have to expand our educational outreach and career pathway programs. Oftentimes you hear people talk about pipeline programs, and that is the same. We have renamed or rebrand that to career pathway programs. We were fortunate enough to get a $1 million grant from HRSA last year to expand on our pathway programs. And then we were able to get, most recently in the last 2 years, a grant from the Colorado Department of Human Services, the Office of Behavioral Health Administration, that we are expanding and exposing students who are first-generation students, students that come from historically marginalized communities, and folks from varying low economic, socioeconomic backgrounds that actually we're exposing them to this campus. We're exposing them to health profession careers, and to let them know that they too can have this opportunity. We just need to show them how to do that and provide the resources for them to do that. If you're on this campus, you know that in 2021, we launched a campus-wide survey. It's a campus-wide climate survey. And we really were looking at 6 or 7 areas. The areas were incivility, sexual harassment, discrimination. And because our campus is so uniquely different, we added on some things that were specific to our campus. And that is sense of belonging, wellness, and access. And we got a 32% response rate. And for the most part, it showed favorably to this campus that in those areas we were doing well. We are currently in the process of launching what is called the Pulse Survey. And that is to just find out, taking the survey that really focuses on sense of belonging and wellness. How is our campus doing? Are we moving forward with all of the resources that we have put forward, all of our collaborations? Are we seeing an increase in sense of belonging? Are we seeing an increase in understanding what it means for employees, staff, faculty, and trainees to really have wellness? Or, you know, how is that playing out in terms of, are we providing the resources available for that? And responding to the concerns of the local community. Gabrielle Jacobo, many of you know, if you have worked in the community, that she is our director of community engagement, and she works with the Resident Leadership Council that has been around, and they worked in partnership since 2007. Previously, Gabriella was with the Campus Community Partnership. And when the sun set on that program, I was fortunate enough to bring 3 of those employees over. And so that work has continued. They do regular connection campaigns to actually boots on the ground, hear from the community, to say what is it that are priority concerns. Most recently in October of, I think it's been a little over a year now, the concerns were safety, youth, mental health, and healthcare access. And we have put on some workshops and some community forums to address those issues. So we want to be responsive to the community. We want to be culturally responsive to the community, and that's what we're working hard to do. We have our HEAL team, which is our Health Equity Action Lab, which is training folks on our campus, folks off our campus in relation to health equity, understanding your bias, how that impacts your work, how that impacts your bias, microaggressions, what does that really mean? How do we trained culturally responsive practitioners. We are being they have a health equity certificate program that is a 4-part module. And to date, since their inception in 2021, they have trained about 7,000 individuals across our campus and in the community. We're super excited about that piece. We're academia. We are part of academia, and you know how it goes. Though I'm a social scientist and value qualitative research, we live in a world where quantitative research seems to still be at the top. And so data and evaluation metrics and visualization is something that we're working across our campus to say, here are some standards as it relates to inclusion and equity. And we want to make sure that we're capturing that so we can really show the impact of all of our work, both internally and externally from the campus. And then our continued growth and development of our campus-wide restorative justice program. If any of you are familiar with restorative justice, you know that it comes from Indigenous practices. And basically, we're using it here for 2 things. Number one, 3 things really. Number one, to build community capacity around certain issues and identities. The second would be to do culture and climate audits within units. And we are trying to link this then to retention practices as well. So that is literally just a summation of what we are doing. And we are super excited to be doing it in partnership with each of you that are represented here and all of our partners along the way. So thank you for having me.
Couple more. Okay. Hi, everyone. Thank you, Dr. Richards, for really setting the stage for our partnering with community and the importance of that. I'm here to tell you about one center in which that is a piece of what we really value and want to do, and have a program dedicated specifically to that. So we're called the Accord Center, which stands for Adult and Child Center for Outcomes Research and Delivery Science. And I am actually pretty new to the campus as well. I came in January from the University of Minnesota Medical School, and have one of the things that appealed to me alongside what Accords does as far as the programming and the course that they offer was a community engaged perspective. And so all of what I do really in my research has community engagement, or the bi-directional interaction between community and researchers who want to work towards more effective and sustainable research. And those are the key things that happen when you actually partner with community, as you all know. So what I want to share with you today is a little bit about what we do at Accords. So Accords really, if you think about one thing to take away about what Accords is it's really a center that teaches and helps others to do research with our methods. And so you'll see here on the slide that we have what are called cores and programs. And it's really a place where you can go and really get all your needs met in this frame of outcomes research and delivery science. So we really take in the real world and try to impact clinical practice as well as community. And so we don't really do a lot of lab work or the work that's bench science. We do really outcomes research. And for us, really impacting the real world is what we do. And we like to, again, partner to make sure that we do that well. So you'll see here on our cores from quantitative, as was mentioned, to qualitative and mixed methods cores. We do mobile health and moving into some of that AI space that everyone has to pay attention to these days, learning health systems, which are those places that are right in the clinic so that you can think of your clinic as your lab and really understand and do research in the lab so that you're affecting the real world of patient care. Our programs you'll see here also include dissemination and implementation. Again, that place where we're really making the world around us that learning lab so we can really impact and in the real world where people are interacting on a day-to-day basis. And then we also really invest in training and mentorships, as well as educational aspects of making sure that we put out what we want to learn around methods and around helping others to be able to do research and engage with the community around making that evidence that is important to communities. So here you'll see a few things that we've done over the last year, at least within the work that we do in Accords. So you'll see we do a lot of that education and trying to put out there what we learn in our different courses and programs, and as we partner with others in doing this work and training others in those efforts. So you saw that we partner with CCTSI in our community engaged program. And so trainings around how to do community engagement, and the actual methods that work in CBPR, so we can make sure that we're truly doing the type of work that is effective and sustainable over time. So we do conferences. So in the back, you'll see our table that's advertising CopperCon. I also put, there's Jordan waving. I also put our little handout, if you're interested in grabbing it, it's a short summary of Accords and what we do. As I mentioned, early career faculty, we want to really make sure it's embedded in them how to do good research, how to do outcomes research, and engage with community. And so we offer both the training and fellowships that allow them to be trained in this real world practice of health services research. So with that, I will pass it on.
Hi, everyone. I'm little, so I am here. There's no step stool or booster. My name's Deborah Paramedina, and as Regina said, I just recently joined CU on Schuetz Medical Campus as the inaugural executive director for the Center for Health Equity. And applause to all you, because I'm only here because of the efforts of the campus and the community who really came together to advocate that the campus needed a center that with this focus. Also, the resources that were required to establish it, and also some of the strategic planning. So I'm fortunate to be able to come into a space where a lot of thinking has already happened and coalesced around what the center is going to be able to accomplish. And so, or is, you know, its goal is to accomplish. So what you see here is basically like the landing page that we have for a web presence right now. So if you go to the main CU campus website, there's a tab at the top that says community, click on that. And you scroll to the middle and you'll find a button for ODICE. And then kind of right next to it, it'll be the Center for Health Equity. And what you can see here is both our mission and our vision. And the center is really new, right? So it was initially conceptualized and launched in 2021. And that's when people started to come together to define the mission, the vision, and create a plan of action. And then the hunt was on, or the search was on, right? To find a leader for the effort. And so fortunately, the stars aligned, and I'm here to be able to make this vision a reality. And yes, and so I'm excited to be here right now. You know, I've been doing a lot of having conversations with people, trying to understand the landscape and that sort of thing. So what we want to do in terms of our mission, of course, is to advance community health, wealth, and well-being. And we want to do that through impacting systemic racism and oppression, and create opportunities for learning, service, research, and advocacy. So these are basically going to be the 4 areas that we're going to be focusing on. At the core of the center is community engagement. So how are we going to do this work collaboratively? So this is a different way of kind of starting a research center, right? From the beginning, having the community identify what are going to be some of the priorities that we're going to focus on. And then kind of reach in to the campus and see where these where there's alignment. And so we definitely want to learn, do mutual learning, right? We learn from the community and we share what we know. Service. There is a lot of knowledge, assets, and resources on this campus. How do we leverage it for the benefit of the community? So I think this will be an important resource that'll be available, I think, in the fairly short term, where the community can feel like they can come to the center if they need technical assistance around grant writing, evaluation, data collection, and that sorts of things. So we want to make sure that we have an open door policy with respect to service and leveraging assets and resources on campus. Of course, we are an academic institution and we want to focus on research, right? but we want to do that again in partnership with community along priorities identified by community in an effort to advance our community's health. And we want to also ensure that the data and the evidence informs policy and action. So we want to make sure that this information is distributed or disseminated right into communities in usable formats so they can access it in real time and use it to advance advocacy efforts. And so we'll be working collaboratively with people who are here, the different leaders that you met. And I'm looking forward to meeting all of you who are sitting around the table and in the chairs. And I, just want to invite you to reach out to us and tell us, what you think are the priorities and what we should focus on. And I'm here to listen and learn as the first step. And I just want to thank everyone for your attention and for having me here today. And I look forward to working with everybody. Thank you.
Yeah. Okay, let's see. I gotta find our slide here. Here we go. I'm gonna wander. Yeah. So, so for those of you that don't know what CCTSI is, it's the Colorado Clinical and Translational Sciences Institute. It's funded so that, oh, it's advancing on its own. Yeah, stop that. So, a lot of academic health science centers have something like CCTSI. And the reason that they exist is that about 20 years ago, a light bulb kind of went off in Bethesda, Maryland, that, just publishing papers and coming up with neat discoveries was important. But if they never reached the people 5 blocks in that direction, it really doesn't matter. And so the director of the NIH at that time said, we got to do something about this. And they created the CTSA program. And fortunately, they realized that as a part of that program, all of the institutes that they were going to fund at places like this needed to have an emphasis on community engagement, needed to have a core that was dedicated towards community engagement. Because if we're not finding out what the needs are of the people 5 blocks in that direction, we're not likely to hit the mark when it comes to the science that we're doing on this campus. So we're one of those groups, and CCTSI supports all kinds of stuff from bench to bedside, to translation into practice, to translation into community. And we're here to help folks at any place where you're at along that timeline and that translational spectrum. If you want to make sure that your work is going to have an impact, we're here to help. So how do we help? So we have a consult program that we have a committee that includes both academic and community members that are available to consult with you. What are the research topics? What are the priorities that we're hearing from communities that we have? Folks like Leslie as community research liaisons, helping us to understand what the needs are in those communities. We can help with that. We have a training program. We just kicked off our, what is it, 9th cohort of CIT? 13th cohort. So we're, Dr. Richards, see what you started there? So that's amazing. And those folks are going to spend 6 months with us. Part of their time they'll be immersed in a community led by our community research liaisons in those communities to learn about what the needs are, what it's like to engage with those folks. And then the last thing I'll just touch on is our pilot grant program. So our pilot grant program, I'm really proud of, and I can't take credit for the design, but it's really pretty unique. It's designed, number one, as an academic person, you can't just write a pilot grant proposal and get it funded. You have to do that in partnership with a community member. So there's both an academic PI and a community PI. And there's 2 tiers. The first tier, you get 9 months to meet, figure out what are the needs, how can you actually work together? If that works out, great. Then you go on to the joint pilot award. So that's a pretty unique thing. I'm also proud to say that all of our grant proposals are duly reviewed by somebody from the academic side and somebody from the community side. And not that they read it independently and score it independently. They read it together, they talk about it, and they score it together. And that's pretty amazing. So that's a little bit about what we do. Our team is myself, Mary and Kaylee in the back of the room, Montel Temez, and Jen is our administrative lead. Come talk to us. We'd love to hear from you. If you're not on our listserv, so you can get announcements, let us know, and we'd love to be in touch. All right. Now we're done talking at you. Thank goodness. Okay, now can I get, there we go. Okay. So if you want to watch previous community engagement forums, you can go to there's a link, I think, both on our CCTSI website and on the Accords website, so you can find those. And we came up with some conversation starter questions. So as you circulate around the room and you meet with our community partners, if you're a researcher, we've got questions for you. If you're a community organization, we've got questions for you. What are you trying to tell me? They're not moving for you. Okay, Jordan is here to help. Yeah, right. No kidding.
If it doesn't. Here, you can-
All right. So we'll leave those questions up, and we like to make this an authentic sort of meeting. So one of the things that I like to preach is that all of us in this room have expertise. Okay, I've got research expertise. I know about qualitative methods and survey methods. The folks at the tables around this room, they have expertise too. They have a ton of it, expertise in what's going on in their communities, what their organizations are trying to do. And so think about that as you're talking to one another. How can you learn what each other's expertise is? And how can you meet? And I think that's it.
Yes.
You got
Like 2 logistical
2 things. All right,
Um,
go for it.
Yeah. So for those of you who are still online, we do have some slides from each of the partners in the room. They'll rotate through for the next few minutes. So if you are interested in knowing who was here, but you couldn't be here on campus, please take a few minutes to see those slides as the rest of us start to meet in person. And then for everyone, I just want to say this before we move to networking. So if you need to pop out in the next half an hour or so, please take a minute to do our evaluation, give us some feedback on this format. Again, this is our first time back in person. So we really want to hear from all of you, both what you'd like to see in the future, but also how this is working for you today. And then I think we can move, like Don said, we really want this to be an opportunity for people to meet each other. So take some time, move around the room. Whenever you take off, scan a QR code or grab a paper evaluation in the back of the room. And if you haven't yet, please grab lunch. We still have some lunch out there and we want to make sure everybody's fed today. So thank you all for being here today. We really appreciate having you and please go meet someone new. Thank you for switching us over.